Hello, I am Dr. Rajakumar, consultant pulmonologist. We will be discussing the correct way of taking any inhaler. So first I will be discussing about the DPI. So DPI, as I have already shown, it's a capsule which will contain a dry powder. DPI by definition is dry powder. So it is available in the form of a powder. So depending on the brand which we are using, we have for example this device we call it as a loopy inhaler, and there are few other brands which comes with rota inhaler. The purpose of all the devices is to make this capsule to break and release the powder into the chamber which the patient is going to inhale. So for example, now I will be explaining on this loopy inhaler. So this is a small device, this is the capsule. We have to open this and then place the capsule inside, then close this chamber. These are the two knobs. By pressing it, the capsule will be broke and then the powder will be released into the chamber. So now what the patient has to do is this has to go into the patient's mouth, close his mouth, form a tight seal on the inhaler, and then patient has to inhale deeply and hold his breath this way. Hold breath for 10 seconds and then exhale it through the nose, and then we have to repeat similarly. One capsule we have kept, so till the time the powder is emptied from the chamber, that patient will be getting no. And we have few other forms of devices where you will be able to see the powder, actually how much powder is left in the chamber. There are few other brands which can be transparent, there where patient can be able to see how much powder is left. If you are feeling that the entire medicine is over, then one puff is enough. If you felt that there is some amount of drug still left in the chamber, so we have to repeat again. And the most common thing what we miss is, after taking the inhaler, we have to rinse our mouth with the water. Why? Because when we are inhaling through the mouth, so there is a chance these powder particles may get stuck in our hard palate, mouth. So those people who are immune compromised, chances of getting oral ulcers or some mouth infections are very rare, but there is a probability. So it is always advised, whenever the patient is using any form of inhaler, to rinse the mouth after using the inhaler. So then this is the DPI. Then going into the MDI. So these are the most commonly used inhalers, MDI. So where a lot of hand and breath coordination is required, so this has to be taken care. The right technique is very important when we are taking the medicine. So what is the first step of taking MDI? So first thing, we have to remove the canister from the this thing, and then we have to warm the canister, because that it has a medicine and then HFA, which is a propellant which will help the drug to carry out from the nostril and to be delivered into the airways. So we have to mix those two things. First thing is we have to warm the canister, then we have to place it back into the chamber, and then we have to shake it thoroughly. So as I have told earlier, we have two components, one is the medicine and one is the propellant. So we have to make sure both things are mixed. So because when the inhaler is stagnant, the propellant will be sitting at the front. So when we are using without shaking the device, so the thing which first comes into the mouth is going to be the propellant. So there won't be any drug. So that improvement won't be there. So first make sure you have to warm the canister, then we have to shake the inhaler thoroughly, and then we have two things, whether we are using with the spacer or without a spacer. Spacer is a transparent device which is around like 5 to 6 centimeters in a length. Again, multiple companies have multiple types of spacer. This is one type of spacer which is commonly used. So we have to lock this spacer. Few companies have a complete sealed device as well. There is no need of locking or anything. So this is the transparent tube which we call it as a spacer. So few people are using an MDI without a spacer, or few people are using an MDI with a spacer. So whoever is using without spacer, it is advised, please start using with the spacer. We will be discussing the benefits of spacer in my next video. So comes to the technique how we are going to take. So as I have told, first we have to warm the canister, then we have to shake this, then comes we have to remove, and then one end goes this, lock it. The second end we have to remove this thing. So this thing goes into the mouth. We have to bite it with our teeth and then again form a tight seal with our lips. Then if you are able to see, the moment I press the canister, I don't know how many of you can see this, but there is a mist coming into the spacer. So what it is going to do is it is going to keep that mist in the suspended form, so which is available for the patient to inhale through the mouth. So how we are going to do? So similarly, as I've told, we have to bite it with our teeth. Remember, the tongue should not be interfering in between. So we have to bite it with the teeth, then form a tight seal with our lip, then we have to inhale it deeper and faster. Similarly, we have to hold our breath, again count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, which is 10 seconds, and then exhale it through the nose. So we have to remember one point, we are not supposed to exhale it through the mouth back into the spacer. So always inhale it through the mouth and then exhale it through the nose. Okay, then how many times we have to do? Because as I've told, the drug is suspended in the spacer, so we can take it as many times as 4 to 5 times. So every time it is the same, like we have only one puff, doctor has advised only one puff. Remember, one puff means we have to press once. So this is one puff, done. Then we have to take it, inhale it, hold and then exhale. That is one cycle. Again, we don't have to press because doctor has advised only one puff. So again, inhale, hold, exhale. This is the second. Similarly, inhale, hold and exhale. This is the third time. So till we finish how many ever repetitions has been advised by the doctor. Few advise 4, few advise 5, few advise only 2. So depending on the patient condition. So usually 4 to 5 is ideal. So once you finish all the 4 to 5 repetitions, then only you have to remove the device from your mouth. Then again, the next step comes, we have to rinse our mouth immediately after taking the inhaler. So breath accentuated inhaler, which I've spoken, where that is also similar type of an inhaler, looks like similarly like an MDI, where we don't require any spacer and we don't require to press the canister as well. So it is already pressurized and breath accentuated by name. The moment patient takes deep inhalation, the drug will be delivered from the nostril and it will be delivered into the lungs. So the advantage of the breath accentuated inhaler is that hand and breath coordination is not required. And then preferably the best way of taking inhaler is an MDI with the spacer. So always remember, don't use your MDIs without spacer. So with this, our advice is to do take inhaler as advised by the doctor as many times and as many puffs as been advised, and with the spacer. Always remember to use your MDI with the spacer. And see you in our next video, what are the advantages and disadvantages of using inhaler with the spacer, without spacer. Thank you.